Hi all, welcome. Welcome back for another webinar about sleep apnea issues. Just giving another minute before we start into tonight's topic. As usual, if you have any questions at all or comments, just feel free to leave a question or comment down in the comment section. I try to get through as many questions as I possibly can. It's my absolute passion to help people with their sleep apnea and other sleep disorders. So any questions you have below, feel free to ask. Hi, Fred. How are you doing? Good evening. Thank you so much for joining. Okay, we'll just wait until well, let's start now, right about now. It's 8:32 Eastern Standard Time. Lizard Creek. Love that name. Okay, guys, let's get into it. So tonight's topic is all about whether or not it's okay to discontinue using your CPAP, even if it's only for a short amount of time. So I've discussed this over and over and over. CPAP is a struggle. It's super hard to get used to. There's a lot of complications that are involved with getting over the side effects and getting over that initial adjustment period of using a CPAP. And sometimes things crop up, like we need to travel, or we start having side effects, or we really just can't get used to that CPAP and sleep well throughout the night, where we start to think maybe I should take a little break from CPAP. But is that actually a good idea? Just to kind of give a general idea of whether or not it's ever a good idea to stop CPAP, it really depends on the situation. So if you feel like you need to take a break from CPAP, just to take a break, just to not use it for a while, you really don't have a specific health concern that you're worried about by using CPAP. Your machine is still working, there's no issues with it, then it's probably not going to be the best idea for you to discontinue your CPAP for various reasons, which I will get into. Now, on the other hand, if you start having a lot of side effects from using your CPAP, or you've been using it for a while and you simply find that you're not sleeping soundly with CPAP, or it's too invasive, or maybe your machine breaks down. A lot of people are having issues with this horrendous Philips recall. So I can understand that a lot of people did have to take a break from their CPAP for a while. But if you do have to take a break from your CPAP, whether that's short-term or long-term, I'd just like to give you guys a little bit of an idea of what you can expect with your body, with your life in general, if you do take a break. So I'm going to talk about short-term issues that can crop up if you discontinue your CPAP, and also some long-term issues. Now, when I talk about short-term, I mean a few days to a week. Any longer than that, you're really going to start to have some effects on your health. Short-term isn't necessarily hugely problematic, especially if you have an end date to where you will be using your CPAP again. Taking a day or two off to get your CPAP fixed, or if you have to travel somewhere and you can't take it with you, is usually not going to be a huge deal. But let's just talk about some things that could happen in the short term if you did stop using your CPAP. So the first short-term issue you're going to run into if you suddenly discontinue your CPAP is you're simply going to get less deep sleep. So when I say deep sleep, I mean that really slow wave sleep where you're completely unconscious, and also a bit of REM sleep as well, so your dream sleep. Those are the two stages where you're really doing the most recovery at night. Your body is doing the most work to help you, feel well rested the next day. You're doing things like repairing tissues, repairing cells, releasing hormones, resetting your brain, resetting your entire body, really. So we do know that when somebody has sleep apnea and they stop breathing throughout the night, when their oxygen levels drop, when they stop breathing, their brain will generally wake them up so that they can recommence breathing and get their oxygen levels back up to normal. So even if you don't realize you're waking up, we call those micro awakenings, where you might only wake up for a few seconds and fall back to sleep. That process of your brain having to kick you out of those deeper sleep stages really keeps you from getting the deep sleep that you need. So this is why people who have sleep apnea, can sleep for a really long time, but they still feel chronically tired. And that's really because they're just simply not getting enough restorative deep sleep. So that's the first obvious thing that's going to happen. The second thing that you can expect to happen if you suddenly go off CPAP is you will get increased nighttime awakenings. And this goes back to what I just said. Every time you stop breathing, if your oxygen levels drop enough, your brain is going to wake you up to recommence breathing. Now, some people, like I said, will not notice these awakenings. They will be micro awakenings. Some people will wake up fully and, they may be awake for a few minutes. They may not be able to fall back to sleep at all, especially if you have overlapping issues such as having sleep apnea and insomnia. So when you are properly treated for sleep apnea, people just tend to wake up less in general, and they're able to sleep better throughout the night. So if you go off your CPAP and you notice that your sleep is very fragmented all of a sudden, that's probably because you're deoxygenating at night and your brain is trying to wake you up. Okay, let me just have a quick look. And like I said, guys, feel free to drop questions below. This webinar is going to be relatively short compared to the previous one, so I can answer more questions for you because I know people have a lot of questions. And so instead of rambling on all night, I'm going to allow people to take more time to get their questions answered. Okay, the third short-term effect of discontinuing your CPAP, another obvious one, is you're going to feel sleepier during the day. You're going to feel more fatigued. And this goes back to the first 2 points. You're getting less sleep. You're waking up more often. So even if you feel like you had enough hours of sleep, you're still going to feel more fatigued than you would if your breathing was properly corrected by a CPAP. And sleep debt, so that lost sleep does compound over time. So, the first night off of CPAP, you might not feel so bad. But if you continue staying off your CPAP, you're going to build up a lot of sleep debt that you simply aren't going to be able to pay off properly because of your sleep apnea. Hi, guys. Thank you for attending. Is there any alternative to using CPAP? Yes, that's an excellent question. And I will get into this, especially when, there are reasons outside of your control for not being able to use your CPAP machine, such as a mechanical failure or a recall, for instance. So I will get to that at the end. So I'm going to go through all these points first, and then we can talk about some alternatives. Even if you're just sick of using CPAP and you want to try something else, it's just good to know what sort of products and therapies are actually available for you, because I don't think a lot of doctors take the time to explain this to their patients. What tends to happen is you go and get a sleep study and your doctor will automatically prescribe you a CPAP without really telling you your options. So we'll go through those quickly at the end. Okay. Number 4, for the short-term side effects you can expect to experience when going off of CPAP briefly. So number 4 is going to be cognitive issues. And when I mean cognitive issues, I just mean how your brain functions properly. So you might find that your attention span is not as good as it usually is. You have a really difficult time focusing during the day. Your memory might be a little bit fuzzy. It might be harder to recall things you've learned, previously. You may find that learning in general is just more difficult for you. And you may also find that your brain is just kind of foggy and not quite, as alert as you would like it to be. And this is, again, going back to just the fact that sleep apnea is sleep depriving. It sleep deprives you. So, even if a person didn't have sleep apnea, if they lost as much deep sleep and good quality sleep that somebody with sleep apnea has, they would also experience all of these symptoms. So, just keep an eye out for things like if you find that your attention span is really short, or you find that you're trying to read the same chapter over and over in your book because it's just not sinking in, then that may be a sign that your sleep apnea is starting to affect your cognition. Number 5 is mood. And we've touched on this several times already in my previous webinars. So sleep apnea has a pretty significant effect on your mental health and well-being. Being sleep deprived itself makes you less able to deal with stress. So the area of your brain that deals with stress and processes emotion really gets rebooted when we get into those deeper sleep stages. So when you're not going through that brain reboot every night, such as when you have sleep apnea, your brain is less able to handle, incoming stressors. So stimulus in your environment, problems that come up throughout your day. Your emotions also tend to take a deep dive because you're not releasing as much serotonin. That's one of your feel-good chemicals, and your brain's just not functioning properly. And unfortunately, when our brain stops functioning properly, one of the first things to happen is we will see a decline in our mood. Quick question. I have complex sleep apnea and my doctor has me trying to use ASV. My cardiologist cleared me for this machine. I'm struggling to get used to this machine. It seems to make me have chest pressure. I do not have heart failure. Let me just scroll up. An ejection fraction. Are there any dangers in using this therapy? So it really is going to depend on your situation and what your cardiologist says. But if it's causing you a lot of stress during the night and you feel like it's causing, respiratory issues, or it's causing like heart palpitations or anything like that, I would strongly advise you to speak to your sleep therapist or your sleep specialist about your other options for treatment. So the options that are going to be appropriate for you are going to be very dependent on your situation. So that's going to be things like other health issues, how bad your sleep apnea is, and what is actually causing your sleep apnea in the first place. Complex sleep apnea is a little bit tricky to deal with because it's not simply just obstructive type. There's also other issues involved. So it really depends on your severity, and it's potentially possible to go on other treatments, but you would need further assessment. Okay, another question. I've been waking up a few times during the night craving junk food. Has this anything to do with CPAP? Generally, I do eat 3 hours before bed. So potentially, yeah. So a few things could be happening here. If you wake up craving junk food, you could be in a hypoglycemic state, which means your blood sugar is just getting a little bit low, and it's going to stimulate your brain to want to reach for kind of those high caloric foods. So I would suggest, maybe keeping a small snack by your bed, something that is, has a low glycemic index, but is also going to boost your blood sugar and keep it stable throughout the night. You may want to try eating closer to bed. So generally 3 hours is fine for a lot of people. And I would never recommend eating 1 hour before bed, but you can usually get away with 2 hours before bed, and have something with a low glycemic index. So that's something that's not going to really overspike your blood sugar, but it's going to keep your blood sugar stable throughout the night. So this would be something like oatmeal, for instance, with a little protein on the side. So maybe oatmeal and some yogurt. That would be a really good option for you. So give that a try. I'm not really sure if it's related to the CPAP. Maybe. It's hard to say though. Okay, let's quickly get back into some more short-term issues with discontinuing CPAP. So we talked about mood, snoring. A lot of people with sleep apnea also snore. This is pretty well understood, and that's because the same tissues that can cause those obstructions in the upper airway can also vibrate when you do breathe, and that's what causes snoring. So you would likely see if you do snore, you will likely see your snoring return. Now, obviously, that's going to have consequences for you, like a sore throat or dry mouth. It's also going to probably disrupt your partner's sleep. So it's just something to keep in mind. And number 7 would be just general side effects of discontinuing your CPAP. So these are going to be things like morning headache, dry mouth, sore throat, increased nighttime urination, typical things that we see for people who have untreated sleep apnea. So those things can quickly come back into play when you're not breathing properly during the night. Okay, I'll take a question or two again before we get into the long-term effects of discontinuing your CPAP. Okay, let me just scroll down here. I used my CPAP for a month and did not find it helpful. Then something went wrong with the machine and stopped using it. They sent a new one, but I did not use it at all. This was in 2015, and I've been on my own. I'm doing another sleep study home with Watch Pat 1 this week, hoping to get something other than CPAP. Okay, yeah, and that's fair. So I always recommend giving yourself 6 months of an adjustment time, and you have to follow certain techniques to actually get used to CPAP. It's not just about putting it on and expecting it to work. You have to allow your body and brain to actually get used to using the machine, get used to the pressurized air entering your lungs. It's a mental challenge as much as it's a physical challenge. So I actually made a previous webinar about all the techniques you can use to get used to your CPAP. I highly recommend going back and watching that webinar. If you can't find it, let me know and I will link it to you. But that's not to say that you need to stay on CPAP. So if you're finding it's just not working for you, you absolutely hate it, there are other options. So things like oral appliances, surgical options, Inspire device, positional therapy if you're a candidate. The therapy that is going to work for you, again, is very dependent on the type of sleep apnea you have, how severe it is, and whether it's positional. So you'll need to work closely with your doctor to determine if you can use something like a mandibular advancement device. Most people who are in the mild to moderate range are going to be very successful with alternative therapies. People who sit in more of a severe range of sleep apnea are really going to need to rely on the CPAP and some surgical options, unfortunately. Okay, if you're waiting for a CPAP because of supply chain issues, is there something more you can do to help OSA besides not sleeping on your back? I'm exhausted all the time. Yeah, so it's tricky. And again, what will be helpful for you that you can do in the immediate future? So I'm talking like over-the-counter devices, different sleeping techniques, is going to be very dependent on how severe your sleep apnea is. So people with mild sleep apnea have a lot more options. That's just the unfortunate truth. Side sleeping only works for people who are positionally dependent. That means that their sleep apnea is worse on their back and better on their side. That has to be determined by a sleep study or by a home sleep test, like what my company does, Wesper, or any of the other companies that do that too. So options would include something like a mandibular advancement device, which I just talked about briefly. The prescription version of that requires a visit to a dentist that practices sleep dentistry. They also have over-the-counter versions of mandibular advancement devices, which are more like, your standard boil and bite mouth guards. So one, they're not going to be as specific to your mouth and your teeth. Two, they may not be adjustable enough to correct your breathing. Now, there are some good ones out there. There are some over-the-counter mandibular advancement devices where you take a mold of your teeth, you send it in, they create one for you, and they help you adjust it. And then there are some kind of like cheapy ones that slightly pull your jaw forward. They're very clunky. They're not super comfortable. And they're mainly promoted for people who snore. So that's a possibility. Another thing you can do is head elevation while you sleep. So if you can, kind of sleep not sitting up, but just elevated. So like using a foam wedge or an elevated pillow, sometimes that can help open up the airways. If you can breathe successfully through your nose, sometimes using mouth tape can help keep your mouth shut, and that can do you a lot of good for your breathing. And you can also do oral exercises. So if you go online and look for oral exercises for sleep apnea, there's these exercises you can do to strengthen your airways and the muscles of your throat and tongue. So you would do these exercises 10 minutes twice a day. Alternatively, I would suggest talking to your doctor about whether an alternative therapy other than CPAP is right for you. And I understand with supply chain issues, it's super absurd right now. And with the recall lately, people are having this problem. So I really do empathize with your situation. If you would like more information on some alternatives that you can go buy today without a prescription, send me a message. I'm happy to send you some links to those things. Okay, I will quickly get into the long-term effects of discontinuing CPAP, and then I will take some more questions. You guys have brilliant questions. I always love them, love to help. So keep them coming. Okay, so we just talked about short-term CPAP discontinuation. That would be like if you took a trip or only went off of it a few days or a week. Let's talk about long-term CPAP. So it's pretty common knowledge that a lot of people get frustrated with using their CPAP, or if their machine breaks or if it gets recalled, they're going to go without their CPAP for a much longer period of time. This could be, several weeks to several months to years. And so it's not uncommon for me to hear from my clients that they just hated their CPAP, so they just stopped using it altogether. Unfortunately, the long-term effects are going to be a little bit more detrimental. Well, not a little bit, a lot more detrimental to your health. So it's just important to be aware that if you do need to go without CPAP for an extended period of time, talk to your doctor about alternative therapies. And like I said, I will get into those alternative therapies in a bit. So, number one is chronic health issues. So I've talked about this extensively in my previous webinars. Sleep apnea is strongly correlated with a handful of chronic health issues, primarily things like cardiovascular disease, especially, hypertension, and then, extensive cardiovascular remodeling, which means that it places a lot of strain and inflammation on the heart, and it can do damage to your cardiovascular system. Other things that are pretty common to crop up in people with long-term sleep apnea who are untreated, diabetes is super common. It increases your risk for certain cancers by up to 4 times. It places you at a higher risk for neurodegenerative disorders like Alzheimer's disease and dementia. And it also massively raises your risk for developing a mental health disorder, in particular, depression and anxiety. So, going off may seem more comfortable, but in the long term, it's going to be less beneficial for you to not be on treatment. And the unfortunate reality is that the longer you are off your CPAP, the more and more likely it is that you're going to develop these diseases. And it's not uncommon for me to see people with the beginning stages of hypertension all the way up to full-blown cardiovascular disease. So, keep that in mind. If you do have to go off of your CPAP for a really long time, pay attention to your blood pressure, pay attention to things like weight gain, and also pay attention to things like sugar cravings, because those are all signs of cardiovascular issues and metabolic issues that can occur. Okay. Number 2 is increased risk of accidents. So statistically, people with untreated sleep apnea are at a much higher risk of getting into any sort of physical accident. Most of the research has been done in motor vehicle accident and heavy machinery accidents. And that's simply because you're overtired. And we know that when you get to a certain point of sleep deprivation, it's basically equivalent to being drunk. So, you're at a state where if you're untreated and you're chronically tired, that you're really driving impaired. And we know that your risk of getting into an accident, which can either injure you, kill you, or injure or kill other people, is a lot higher. So, it's really important to be aware of that. It's really important to keep tabs on your fatigue and sleepiness before you get behind the wheel. Okay. 3, I just briefly touched on this, but mental health. Having sleep apnea increases your risk of developing a chronic mental health condition like major depressive disorder or anxiety disorder by about 50 to 60%. And the majority of people with untreated sleep apnea have some form of depression or anxiety in their life. It can also affect other mental health disorders as well, because mental health disorders are very, very sensitive to sleep deficit. So this can include anything ranging from attention deficit hyperactivity disorder, schizophrenia, autism, borderline personality disorder, you name it. Pretty much any mental health disorder is going to be affected by sleep. So if you've been off your CPAP for a while and you find that your mood has started to shift, or you're highly anxious, or you're starting to get some signs of depression, then that could be directly correlated to your inability to get a proper sleep at night. Okay. Number 4 is effects on your work, family, and social relationships. So this is not really a surprise, but there have been many studies that have shown that people who do have sleep apnea that's untreated are at a higher risk for having poor workplace performance, at a higher risk for family issues, whether that's like domestic issues, or being able to participate in family bonding practices, and also social life. So, people with chronic sleep apnea are less likely to socialize and go out into the world. And again, this all comes back to just feeling poor during the day. So, you're sleep deprived, you may have some other health issues involved with your sleep apnea. It's just not a good combination to be able to function properly at work or in the home or in, your social life. Number 5, and I've talked about this pretty extensively before, but one of the most noticeable long-term effects of sleep apnea is unexplained weight gain. And I'll briefly touch on the science of why this happens, but sleep apnea significantly increases your risk of gaining weight and potentially becoming obese. So we know that weight and obesity itself can cause sleep apnea, but it's also the other way around. And this is because sleep apnea causes sleep deprivation. And we know when you're sleep deprived, your body basically goes into survival mode and starvation mode. So you'll start reaching for really high calorie, high fat foods that you wouldn't normally reach for if you were well rested. We also know that it really slows down your metabolism and your body's ability to control the hormones that control hunger and satiation, or that feeling of being full. So not only do you feel hungry all the time, but your body is also going to store a lot more fat than it normally would. So significant amounts of weight gain are not uncommon when you go off CPAP. Okay, number 6 is increased rates of infection. So this is infection from viruses, common cold, flu, COVID, really any virus, other pathogens, so bacterial pathogens, so things like skin infections. You might find that your skin starts breaking out because you're more sensitive to the bacteria that causes acne. You might find that you start getting dental abscesses. And this is because one thing that sleep really does need to accomplish is it strengthens our immune system, and it keeps your immune system what I call up to date. So it keeps your immune system familiar with those pathogens and helps it recognize that you need to fight off those pathogens. When you're not getting enough deep sleep, you're essentially depriving your immune system of its maintenance. And so you will find that you will have increased rates of colds, flus, infections, fungal infections. So really any pathogen, any microscopic organism that can cause infection, you're more likely to catch. So if you find that you start, your face starts breaking out, or you're getting a lot of colds, then it's probably a good indication that you're not sleeping properly, and that may have to do with not using your CPAP. And finally, this one's a little bit morbid, but early death. And, it's a harsh reality of chronic sleep apnea that goes under control. We know that individuals who do not seek treatment and have long-term sleep apnea, their life expectancy is a lot lower than an individual who does receive treatment or does not have sleep apnea. This can be as much as 5 to 10 years off of your lifespan. And this really has to do with the effects that long-term sleep apnea has on your cardiovascular system. We also know that people with sleep apnea that's uncontrolled are more likely to go into sudden cardiac arrest, so a heart attack, compared to the general population. And that's even if you're, young, fit, and healthy. So it's a scary statistic, but it just goes to show how important it is to actually get treatment for your sleep apnea. Okay, so we've just gone through all of these things that can happen if you go off your CPAP in the short term and long term. Let's quickly go over some CPAP alternatives, and then I'll answer some more questions for you. So if you have no access to a CPAP because your CPAP breaks or gets recalled or there's a supply chain issue, your next easy option, and I've already talked about this before, is going to be an oral appliance that your dentist makes for you. The way it works is it sits in your mouth like a mouth guard. So you just put it in at night. There's no tubing, there's no wiring. And it pulls your lower jaw slightly forward, and that helps to keep your airways open. For best results, you should see a dentist that practices sleep dentistry. Generally, what they'll do is they'll look at your airways. They'll see if anything needs to be corrected surgically, like a tonsil removal or a tissue removal. And then they will fit you for a device, and they will adjust the device until you are sleeping properly and breathing properly. You may or may not need a referral to see a sleep dentist. Most sleep dentists don't require a referral. They may require a sleep study though. Not necessarily in lab, but they may use an at-home sleep test like a WatchPat or something like our company, Wesper. We actually partner with a lot of dentists, so it's not uncommon for them to just send you home with a device. So if you want to go down that route, first you need to identify a dentist that specifically treats sleep apnea. And you can do this by going on their websites. They will almost always list that they treat sleep apnea and snoring, and contact them and just ask them about your options. Other options are going to be a little bit more invasive. So this would include surgical options. For some people, the reason they're getting the obstructions in their upper airways is because they have enlarged tissues. So this might be enlarged tonsils or turbinates, or, a variety of other oral issues that can be surgically corrected. There are over 20 different surgeries available for sleep apnea, and it really depends on what is going on in your oral cavity and your upper airways that would, allow you to get that specific surgery. So you would need a full evaluation by your doctor. They would probably do some upper airway imaging. And there are benefits to surgery, like for some people, once they have the surgery, they're corrected. They don't have to worry about the sleep apnea again. There's also cons to the surgery. Healing from oral surgeries is quite taxing. It's not an easy process. And that's because, you're constantly talking, you're constantly breathing, you're constantly swallowing. So that puts a lot of stress on those tissues. And some surgeries are more invasive than others. So just talk to your doctor about whether you're a candidate and whether it's an option for you. Another therapy that is getting quite popular and that is being covered by more insurance agencies would be the Inspire device. You may have seen commercials for Inspire on TV. Essentially, Inspire is a little electronic implant that goes into your chest, and it runs a little electrode up to a nerve in your neck called the hypoglossal nerve. And at night, you turn your little implant on and off with a remote, and it stimulates that nerve. And the action of stimulating that nerve helps the muscles in your throat and neck maintain tone during the night. And when they maintain tone, it's harder for them to relax too much and collapse and cause those upper airway obstructions. Usually Inspire is reserved for people with moderate to severe sleep apnea. Most doctors will not approve it for mild sleep apnea because mild sleep apnea can be treated by something like a mandibular advancement device. And then finally, positional therapy is an option for those with positionally dependent sleep apnea. So if you have sleep apnea on your back, but do not have sleep apnea on your sides, or you have severe sleep apnea on your back, but maybe like mild sleep apnea on your side while you sleep, you would use positional therapy, which involves using pillows and other devices to keep you off of your back while you sleep. This can be easier said than done, especially for people with pain issues, spinal issues, neck issues. It can take a while to get adjusted to sleeping on your side all night. I always recommend that you get a mattress that is made specifically for side sleeping. They do exist, or a memory foam topper is usually very helpful. Okay, so those are the most common options for CPAP alternatives. So if there's one that you're particularly interested in, talk to your doctor or see a dentist. If you'd like more information, just let me know. I can pass that on to you. Okay, guys, let's answer some questions. Okay, what can I do to warm my air up if I don't have a heated tube and I live with somebody who keeps their place cold? Yeah, so an easy solution is to run your tube under your blanket with you. So you're going to, instead of running your tube over your blanket, you run it under your blanket, and your body heat is going to heat up your tube. So all of the air and moisture going through your tube will get a chance to pass by your body, warm up before it gets to you. So that's going to be your first option. The second option is going to be more expensive, a little bit more tricky. But oftentimes, if you ask your CPAP supplier, you can get tube warmers for your specific model of CPAP. So I would just ask your supplier whether that's a possibility, but just try running your tubes under your blanket first and see if that helps. Hi, Chelsea. Lack of CPAP effects on blood pressure, vertigo, or dizziness events. So what I'm hearing is that you're using CPAP and you're not seeing a drop in your blood pressure and you're still having vertigo and dizziness. So there's a few reasons why this can happen. First, you have hypertension for other reasons other than sleep apnea. Now, sleep apnea is a major cause of hypertension. It's not the only cause of hypertension. If you have a family history of hypertension, for instance, you're going to probably have hypertension regardless of whether or not you treat, for sleep apnea. So this is something to consider, look into, and ask your doctor. You may need to go on blood pressure medication to further reduce your blood pressure while you're using your CPAP. The other issue is it could be possible that your CPAP is not correcting your breathing properly. So it's always important to kind of check in. Most CPAPs have a monitor on them to see whether it's correcting your sleep apnea, and it will give you a report. But if you're not getting that report back and it's still saying you're having a significant amount of apneas, then check with the manufacturer, speak with your doctor, because you may need to have your CPAP adjusted. And then the third reason could be you just haven't been on your CPAP long enough to see those effects. And this is very similar for vertigo and dizziness as well. So it, kind of keep an eye on what's causing your vertigo and dizziness. Is it happening when you stand up suddenly? Does it happen randomly? There are other reasons it could be happening. It could be happening because of medications you're on. It could be happening because you have an inner ear issue. There's a variety of reasons. So yes, while having sleep apnea can cause those issues, it's not the only cause. So you need to work with your doctor to kind of troubleshoot to see if there's something going on. Okay, and just check some more questions here. I do have a covering over my tube that hasn't seemed to work. Yeah, so I mean, it's tricky when you're sleeping in a super cold environment. A lot of people find that making sure their tubes sit really close to their body under something like a big heavy comforter really helps. If it doesn't, like I said, talk to your manufacturer and see if you can get some add-on tube heating equipment or heated tubes. Because unless, your partner is willing to raise the temperature, then it's going to be really difficult for you to adjust the temperature of your air and also the humidity. My doctor reduced my blood pressure medicine by 2/3 after 9 months on APAP. That's awesome. Yeah, so that's a really good result. And I'm assuming he reduced it because your blood pressure was declining normally once you got on CPAP. That's a really good result, and I'm really happy to hear that. So that automatically significantly reduces your risk for long-term cardiovascular issues. And you'll probably see that after a couple years, your blood pressure and your other, health issues are also going to get better and better as you go on. So that's an awesome result. I'm really glad it's working for you. Efficiency of oral appliance for denture wearers. That's a really good question. And I honestly have never had that question before. And it's not something I've ever really thought about. I really wonder if you would have to use your dentures while you use your oral appliance, or if there would be some other way to use it. I'm sorry, I cannot answer that question. So what I'm assuming is that there probably are options for people who wear dentures, because oral appliances are very, very common. And a large amount of the people who use oral appliance, are going to be in their 70s, 80s, and 90s. And so they're more likely to have dentures. What I would do is, if you're interested in going on an oral appliance, ask your dentist whether it's feasible, whether that is even something they are able to do. I'm going to go and do some research as soon as I end this video to figure that out. So if you want to message me, I have a lot of connections with sleep dentists. I can figure that out for you pretty quickly. So send me a message, or you can email me at Chelsea, that's CHELSIE, at Wesper, WESPER.co. Starting CPAP at an advanced age, 70 plus. Yeah, so it doesn't really matter what age you are when you start CPAP. Regardless of when you start it, it's going to offer you benefit for the future. It takes most people the same amount of adjustment time, regardless of what age they are. So you can expect to take about 4 to 6 weeks to fully adjust onto your CPAP. Please use the resources to getting used to using your CPAP that your sleep specialist provides. Or, alternatively, you can go back and watch my guide, my webinar that I did a few weeks ago on how to get used to your CPAP. It's also important to keep in mind that when you're over a certain age, you are slightly at an elevated risk for respiratory infections. So if you have any respiratory issues, make sure you alert your doctor immediately. You may need supplemental oxygen along with your CPAP therapy. That's true, especially if you have mixed sleep apnea. So that means that you have obstructive and central type apnea. And like I said, all of these therapies are highly dependent on the individual. It's not a one size fits all situation. Some people will need one therapy. Some people will need a combination of two or more. What's a good website to research more about the Inspire implant? The American Sleep Foundation should have information about Inspire. The Sleep Foundation in general should have information about Inspire. The Inspire website obviously is a good resource. YouTube is awesome. I always recommend that if you want quick guides to things, go on YouTube and just look it up, because There's tons of people who have already had the device implanted and are using the device, and they give their testimonials. They talk about how they, had to deal with their insurance. They talked about their surgery. They talked about recovery. They talk about what worked for them. So I always recommend YouTube. It's a great resource. Go check it out. Does sleeping on your stomach ease apneas? Oddly, sometimes yes. Not for everybody, but sometimes yes. The theory is that when you sleep on your stomach, because you are putting more pressure on your abdomen, you have to breathe a little bit deeper and harder than usual. So you're breathing more than you normally would. The other thing is when you're sleeping on your stomach, there's no gravity pulling all of those tissues into the back of your throat like they would when you're sleeping on your back. So it's not for everyone. But we do occasionally see somebody who will have sleep apnea on their back and sides, but not on their stomach. So the trick is just figuring out how to sleep on your stomach comfortably. It can take a little bit of trial and error. Is sleep apnea ever hereditary? Absolutely, yes. So we know that if you have a direct relative, so that's a father, a sibling, a mother, grandparents, that have sleep apnea, then you're more likely to have sleep apnea as well. And the primary reason is because a lot of people have sleep apnea because they just have very narrow airways compared to the general population. So those genes that create those narrow airways get passed on. In men especially, and also in women, we do see this quite a bit too, where we'll see mothers and daughters who aren't necessarily unhealthy or overweight, but still have sleep apnea. And again, that's because you're passing on that narrow airway to your relatives. So yes, if you have somebody in your family, direct immediate family who has sleep apnea, then you should probably keep an eye on symptoms because you may develop it too. What is mandibular advancement? Good question. So a mandibular advancement device is an oral appliance that pulls your lower jaw, your mandibular, forward. So advancement just means moving it forward, and mandibular is just your lower jaw. And the action of pulling your lower jaw forward keeps it from slacking. It keeps your tongue from dropping too far back into your mouth, and it keeps your upper airways open. So depending on how severe your sleep apnea is, your jaw may need to be positioned more forward than somebody with quite mild sleep apnea. But most people with mild to moderate sleep apnea will find good success from a mandibular advancement therapy. Can the straps from my mask be causing my headaches? I have loosened them as much as I can. Yeah, they can. They absolutely can. So if the straps are placing pressure on certain areas of your head, that can certainly cause headaches. Other things that I find are the mask also putting a lot of pressure on your sinuses can cause headaches. Another thing is people who wear a CPAP tend to kind of stick to one position when they sleep, and that can just cause a lot of tension in your muscles, and that can lead to headaches. Now, the other thing to keep in mind that sleep apnea itself also causes headaches. Very typical for somebody with sleep apnea to experience a morning headache that goes away over time. So it could be the mask, it could be the straps, it could be this position you're sleeping in, but it could also be that your CPAP machine is just not efficiently treating your sleep apnea. So all of those things need to be investigated and ruled out. Is mandibular advancement therapy surgical or appliance orientated? It is an appliance, no surgery involved. Unless your dentist or doctor determines that you also need some surgical correction, but that's a different process. A mandibular advancement device is a lot like wearing a mouth guard, but it's more custom to your mouth. So it will be, they'll take a mold of your mouth, or they'll scan your teeth, and they will custom make it so it fits perfectly into your teeth. It snaps right in. And so you can take it in and out as much as you need. No fuss. It's generally well tolerated. Some people do find that they can get a little jaw pain with using it, so just keep that in mind. The other thing I like about mandibular advancement device is that you can usually use it in every sleep position. So, it's a little bit, well, it's a lot less invasive than a CPAP. Is it my imagination that sleeping sitting up minimizes my sleep apnea? No, absolutely not. So the action of sitting up when you sleep removes the pull of gravity. So if you imagine when you're sitting up, the tissues that are causing those upper airway blockages are not really being pulled backwards into your throat. When you're laying on your back, gravity is pulling everything backwards. So that's what's going to be causing your obstruction. So some people find that they sleep better when they have sleep apnea with a slightly elevated head, slightly tipped forward, or sitting up. So if you do find that you can't get on your machine right away because of whatever issue, or you're waiting to get another therapy, elevating yourself or sort of sleeping in more of a semi-sitting position may help keep your airways open. Ever heard of an apnea device that is worn on the tongue? Yes, that's called a tongue retention device. They're not super popular and they're not that effective. Basically, they really only work for people who have sleep apnea because their tongue falls back into their throat. And essentially, it's like a little suction cup that sits on the tip of your tongue and keeps your tongue pulled forward. The benefit of those is you can get them without a prescription. They're super cheap. They're like $10 max. So, if you did have to wait to get your therapy, it is something to consider using. Okay, guys, well, it is almost 9:30. We have gone well over time here, but you guys had awesome questions. So I'm going to end this webinar today. Thank you so much for joining again. We'll have another webinar next week. Soon we'll be going into other sleep issues that are not necessarily related to sleep apnea, but can occur with sleep apnea. We're also going to go into more detail about those other CPAP alternative therapies. So if you're interested in learning more about the mandibular advancement device or Inspire, stay tuned. We will discuss that. If you have any questions or you would like to sign up to get notifications for our web series, feel free to send me a message on Facebook, or you can email me at Chelsea, CHELSIE, at Wesper, WESPER.co. And this webinar will be posted. So it goes, it will automatically get posted to the Facebook page that I run this off of. If you cannot find a past webinar that I referenced in this talk, just let me know. I will link it to you. All right, guys, thank you so much. Take care and have a lovely night.